So welcome to this live session. We're going to be covering some of the biggest mistakes I see junior surgeons, aspiring surgeons make when they come to theatre. I'm going to tell you what they are and how to avoid them. We'll get to the surgical ones in about 5 minutes, but I'm going to blitz through the ones which are non-surgical. I have a list. The first thing is when you go to a theatre, know what the case is. Don't go in and ask what the case is. Sounds obvious, but happens all the time. The second thing is know which surgeon is in that theatre and know what they kind of do. Don't know too much, no kind of Google stalking, but just know what kind of surgery they do. It really helps with interpersonal relationships. Know some local anatomy and know how to assist. Now, the assisting thing is one of the most important things. You walk in, you scrub. If you don't know how to scrub, ask one of the nurses to show you. Ask if you can scrub. In the first place, the first thing when you're assisting is help the surgeon see. So if the light is over here, but the surgical site is here, redirect the light. Don't keep moving the light, just redirect the light so that they can see. The second thing is, if they give you a retractor to hold something back, when you are retracting for them, let's say this is a retractor, don't retract for you, retract for them. So help them to see, so the field is away from me and towards them. Don't pull it towards you to see, because at the end of the day, it's for the person that's doing the operation needs to see. You can work around it. Before you start retracting and being too helpful, ask them if it would be helpful if you assisted and retracted. If they don't want it, some people are happy to kind of persevere, or as I say, like to suffer them themselves, then that's fine. Then it comes down to surgical skills and how you execute them. So usually once you've been through the whole case with the surgeon, they'll give you what you've been waiting for, the suture. So the scrub nurse will give you the suture, you take it into your hand. The first thing is how you hold the forceps. If you've never been to theatre before, common problem is which fingers do you put in your fingers and needle holder? Never this, not this, always this. Ring finger, thumb in the needle holder. When your fingers start going down the needle holder, it either means you haven't done it too much or you're a bit stressed. So try and keep the needle holder in the pads of your fingers so that you have the rotational freedom. When you go down past the joints, you don't have the freedom to move. So keep the needle holder in the pads of your fingers. When you go to start suturing, where do you start? If you're doing something long and continuous, go downhill, don't go uphill. If the wound is this way, stitch towards yourself, don't stitch away from yourself. Why? Because it's quicker to stitch this way than it is to stitch this way. So usually what will happen is the first test is you're going to be asked to cut their sutures. So how do you cut sutures? Well, here's the first tip. Which suture to cut? Do you cut both? Do you cut it flush? Do you cut it with length? If the surgeon holds both sutures up like this, you cut both. If they hold one up, you cut one. If you can see the knot on top, you do not cut the suture flush on the skin. Flush on the skin, check out that zoom, means down here. Flush, if they say flush, you cut down here, above, just above the knot. If they say just this, and they go, usually it's like a little grunt. You don't usually get conversation, depending on the surgeon. This which means cut that one, you can see the knot, so you cut just above. How do you cut? You open the scissor, don't go like this and then cut like that. You hold the scissor the same way as you do the needle holder. Open the scissor, slide down, tilt it, and cut. If the surgeon says you should cut flush or cut the suture out, let's say they say cut flush, let's say you can't see the knot, you go, let's say it's deep inside, you go onto the suture, slide down, you angle it so that you're above the knot, and you cut. That's the first thing. So one suture up means cut one, if two sutures up means cut both. If when it comes to you doing it, the next thing is how you hold the skin. Do not pinch the skin and leave a dent. You just want to reflect the tissues back. Go in at 90 degrees, not like this, Be confident, be bold, and just go across. You don't have to come out in the middle if the edges are opposed, and oftentimes when the surgeon's letting you stitch, the edge is already opposed. So go through and rotate. If you're just putting an interrupted stitch, grab it on the body, not the tip. I'm really specific about that, because if you start grabbing the tip, every time you grab the tip, you blunt it, and that will make your next bites difficult. So grab the body, pull it through. What you do not want to do, this is the next mistake, is this. You do not want to be going like this. This shows inexperience and novice behavior, I believe. An experienced surgeon will just pull with one hand. Well, the first thing they'll do actually is put the forceps in their hand rather than putting them down, and then just pull with one hand and wrap. We'll do that again. So the mistake that I don't want you to make is to put the forceps down when you have put your suture in and then start doing this. What you're going to do is, you've taken your bite, you're through, you palm your forceps, you grab your suture with your left hand, and with one hand just pull the suture. Leave a short end which is no more than 2 centimeters and a long end. Mistake number 3 of suturing techniques. I have to zoom out for this one. Suturing up here and doing all of this. This is not how to tie with experience. You want to tie close to where you're operating, and you don't want to be doing all this big movement. So bring your hand close to where you're operating, needle holder is parallel, you wrap between the long and the short suture. You just need to keep your suture still, your needle holder still, and wrap twice around the tip, not the body, not the shaft, just around the tip. 1, 2, and grab the tip of the short suture like this and lay it down. So what we're not doing is all of this. This is too much. We're just going to take the tip of the needle holder and wrap around the tip of it like that. And then you're going to alternate your position of your long and your short. So here we go again. Around the tip and grab the tip, around the tip and grab the tip, around the tip and grab the tip. Now remember, 2 threads up means cut both. 1 thread up means cut the one that's up. So if I want you to cut both, you hold it up. If you want me to cut one, you hold just one up. Make that very clear. If you're not sure, you check. As we said, to avoid this mistake, if you're cutting or someone else is cutting, you don't want this, and then like that, you want to open, hit the suture, slide down, angle it, and cut. We're going to cut both because it's an interrupted. Overhandling of the needle is the next mistake. So somebody asked a question about how I reverse the needle without doing it with forceps. There are 2 techniques. The first is this. So I've gone from forehand to backhand, and I only grabbed the needle once. That was the first technique. Notice how I'm just using my finger to tighten the suture. I'm not using my whole body to go across. So we'll show you that bit again. So this is just how I reverse the needle without handling it more than once. And the other way, which is my favorite way personally, because I think it just looks good, but not everyone likes me doing it, especially the American guys. I push the needle body onto the skin and rotate. Notice how I said I push the needle body onto the skin, not the needle point. So somewhere where it's anesthetized or this patient's sleep, doesn't matter, I push the body and rotate. The ratchet is actually unlocked when I do that. I'll show you one more time. Push the needle body and rotate. And then I'll show you the other technique I did, which I think is also a good method. So watch how I tie the knot, finger tight, and then I'm going to do the opposite side, finger tight, just with my finger, so my whole hand doesn't have to go like this. It's just my finger and my finger, like this. Alright, so I need to show you how I reversed it with the forceps, which is the good, proper schoolboy way to do it. So you go across, grab it with the forceps, pull it through. If I zoom out a little bit for you, you rotate your hand and the needle will twist and the swage will come towards you. So I was here and then I'm there. Because it's between the two teeth, when I go like this, it twists, the needle itself twists itself. The suture keeps the tension, so it just turns around for me to grab it how I want it. And then I'm ready to go. Isn't that a nice, neat trick? And then you just go across. I think both are good techniques. Both have their place. Tie your knot, 2, 1, 1, 2, and then finger goes down, finger goes down. So these are the tricks you need to not look like a novice in theatre. We've covered how to cut the suture, how to reverse the needle without touching it, or the other option being you go across, you grab it with the forceps, it stays in the skin, you rotate like so. So because it's still mounted here, you grab it between the two teeth, you rotate away from yourself, and it shows you that part, and then you mount it and you can go backhand. The other option is you pull it out and just push the body down like so, and you can continue. We've talked about how to cut, so if they hold both sutures up in the air, you cut both. If they hold one suture up in the air, you cut the one that's up. When you cut with scissors, you open a little bit, slide down, angle it and cut. You don't open full force and then cut anyhow. Flush means on the skin. And then the last important thing that often you have to assist with is when the surgeon is tying off a structure. So they'll often clip the structure. So they clip the structure here, and they'll be coming with their tie like this. You have to show them the tip of the forceps. So if they've put it on like this, don't just hold it like that, turn it around and show them the tip so that they can put the suture underneath and around. So you'll be holding it up, and as long as the tip is up, they can carry on. Yeah? And then they say clip, 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 and when they say release, you release. You don't release beforehand. So if they say ease and squeeze means you open, they tighten it, and then you close it again. So off is just off. Ease and squeeze is usually when they're at the base and they want to tighten it again, so you ease by taking it off and you squeeze again. If you're using your left hand to come off, it means you have the scissors, well, usually you have, if you have the artery clip in your right hand, you have to cut with your left. How do you cut with your left? There's a video on this. So your middle and ring are underneath one ring, your thumb and index are on the other, and you're just applying distracting pressure. So middle and index on here, ring and middle on the other, and you're just applying distracting pressure. Why is that important? Because if you're holding the clip with this hand, you need to cut with the other one, so you can cut. And it's a small maneuver, and it has to cut. It's very difficult to try and cut the suture with your left hand. Sometimes it works, sometimes it doesn't, but the best way is to do it like this, because the instruments are right-handed. So those are my top tips on how to look like you're in control of what you're doing. You can join our live face-to-face events off of our website, medsyncltd.com/events. We've got a week's worth of suturing for 1 hour a day, starting tomorrow, all the way till next Friday. Sign up in the link below, and we'll see you there. Take care.